Venlafaxine HCl Er is a medication used to treat depression, anxiety, panic attacks, and social anxiety disorder. It may help improve your mood, energy level, and interest in daily living. It can also decrease fear, anxiety, unwanted thoughts, and the number of panic attacks. Venlafaxine HCl Er is known as a serotonin-norepinephrine reuptake inhibitor, SNRI, which works by helping to restore the balance of certain natural substances, serotonin and norepinephrine, in the brain. The daily dosage and optimal timing for taking this medication should be determined by your healthcare provider. Before you start taking venlafaxine, make sure to read the medication guide and patient information leaflet provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily with food, either in the morning or evening. Do not crush, chew, or dissolve this medication, as it can release all of the drug at once, increasing the risk of side effects. Swallow the capsules whole, or if you have trouble, you can open the capsule and sprinkle the contents onto a spoonful of applesauce, then swallow it without chewing. Remember to drink a glass of water after each dose. Your doctor will determine the dosage based on your medical condition and response to treatment and may direct you to start at a low dose and gradually increase. Take this medication regularly at the same time each day to get the most benefit from it. It's important to keep taking this medication even if you feel well and not to stop it without consulting your doctor. Stopping suddenly may worsen certain conditions and cause symptoms like confusion, mood swings, blurred vision, headache, tiredness, sleep changes, and brief feelings similar to electric shock. Your doctor may need to gradually decrease your dose to reduce these side effects. It may take several weeks to feel the benefit of this medication, so be sure to tell your doctor if your condition lasts or gets worse. Some common side effects of venlafaxine HCl Er include nausea, drowsiness, dizziness, dry mouth, constipation, loss of appetite, blurred vision, nervousness, trouble sleeping, unusual sweating, or yawning. If any of these effects persist or worsen, inform your doctor promptly. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Venlafaxine HCl Er may raise your blood pressure, so it's important to monitor it regularly and inform your doctor if the results are high. Contact your doctor immediately if you experience any serious side effects, such as easy bleeding/bruising, decreased interest in sex, changes in sexual ability, muscle cramps/weakness, or shaking, tremor. Seek medical help right away if you have very serious side effects, including a cough that doesn't go away, shortness of breath, chest pain, severe/pounding headache, black stools, vomit that looks like coffee grounds, eye pain/swelling/redness, widened pupils, vision changes, or a seizure. Venlafaxine HCl Er may increase serotonin and rarely cause a very serious condition called serotonin syndrome/toxicity. The risk increases if you are also taking other drugs that increase serotonin, so it's important to inform your doctor or pharmacist of all the drugs you take. Seek medical help right away if you develop symptoms such as fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, or unusual agitation/restlessness. While very serious allergic reactions to this drug are rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed, contact your doctor or pharmacist. Remember to always seek medical advice about side effects and report any to the appropriate authority in your country. Antidepressant medications like venlafaxine HCl Er are used to treat depression and other mental/mood disorders. They can also help prevent suicidal thoughts/attempts and provide other important benefits. However, it's important to be aware that a small number of people, especially those younger than 25, who take antidepressants may experience worsening depression, other mental/mood symptoms, or suicidal thoughts/attempts. It's crucial to talk with your doctor about the risks and benefits of antidepressant medication, especially for those younger than 25, even if treatment is not for a mental/mood condition. If you notice worsening depression/other psychiatric conditions, unusual behavior changes, or other mental/mood changes, such as new/worsening anxiety, panic attacks, trouble sleeping, irritability, hostile/angry feelings, impulsive actions, severe restlessness, or very rapid speech, it's important to tell your doctor right away. Be especially watchful for these symptoms when starting a new antidepressant or when the dose is changed. Make sure to follow your doctor's instructions on the dosage and the best time to take this medication. Before taking venlafaxine, make sure to tell your doctor or pharmacist if you have any allergies to venlafaxine or desvenlafaxine, or any other allergies. It's important to discuss any medical history with your doctor or pharmacist, especially if you have a history of bleeding problems, glaucoma, high blood pressure, heart problems, high cholesterol, kidney disease, liver disease, seizure disorder, or thyroid disease. This medication may cause dizziness, drowsiness, or blurred vision. Avoid alcohol or marijuana as it can increase these effects. It's important to not drive or use machinery until you can do so safely. Discuss any alcohol or marijuana use with your doctor. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially dizziness and salt imbalance. This can increase the risk of falling and bleeding. Children may also be more sensitive to the side effects, such as loss of appetite and weight loss. During pregnancy, this medication should only be used when clearly needed as it may harm an unborn baby. If you are breastfeeding, consult your doctor before using this medication as it can pass into breast milk and have undesirable effects on a nursing infant. If you have any mental or mood problems, do not stop taking this medication unless directed by your doctor. It's important to discuss the benefits and risks of using this medication during pregnancy or while breastfeeding with your doctor. Drug interactions can change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Venlafaxine HCl Er include other drugs that can cause bleeding/bruising, such as NSAIDs and blood thinners. Aspirin can also increase the risk of bleeding when used with this medication, but if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless your doctor instructs you otherwise. MAO inhibitors should also be avoided during treatment with this medication. The risk of serotonin syndrome/toxicity increases if you are also taking other drugs that increase serotonin. Make sure to tell your doctor or pharmacist if you are taking other products that cause drowsiness. Additionally, Venlafaxine HCl Er may interfere with certain lab tests, so make sure lab personnel and all your doctors know you are using this drug. If someone has taken too much Venlafaxine HCl Er and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe drowsiness, seizures, and a fast or irregular heartbeat. It's crucial to get help right away in these situations. It's important not to share your Venlafaxine HCl Er medication with others. Make sure to keep up with any lab or medical tests, like blood pressure or cholesterol, while taking this medication. It's important to attend all your medical and lab appointments. And if you have any questions, be sure to consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It's important to store Venlafaxine HCl Er at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it's expired or no longer needed, be sure to properly discard the medication. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember not to flush the medication down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.